Hello friends, let's enjoy Dr. Y's Chest Radiology. I'm Dr. Y, medical professor, chest radiologist, Seoul, Korea. Chapter 52. Today we're gonna talk about catheters, tubes, and lines on human body on chest x-ray and CAT scan. Let's go! Catheters and tubes and lines on chest x-ray on human body. How many catheters, tubes, or lines this patient have? 1, 2, 3, 4, 5, 6. Altogether, 6 tubes and catheters. How many catheters, tubes, or lines we do have in the hospital? First, central venous catheter. Among them, central line, PICC, chemoport, perm cath, AK cath, Hickman cath, intubation tube, tracheostomy tube, chest tube, nasogastric tube, also called L-tube, and the famous pigtail catheter for radiologist, and pacemaker. Actually, all are central venous catheters. Among them, we have C-line, PICC, chemoport, perm cath, Hickman catheter, AK catheter. The most important thing of this chapter, the catheter tip position, cable atrial junction, superior vena cava, and right atrium. 2 vertebral body below carina on chest radiograph. The yellow lines indicate above carina, below 2 vertebral body below, the same level of cable atrial junction. The white arrow indicates cable atrial junction. Actually, distal SPC or proximal right atrium. Central venous catheters are used for fluid, TPN, chemotherapy, transfusion, pressure monitor, and dialysis. The catheters are introduced by a right subclavian vein or right internal jugular vein. Right side is more preferable, but left side is also okay. Catheter tip location is between SPC and RA, the junction. It is done usually on operation room or emergency room. This is a normal, good example of central venous catheter position. C-line at the operation room by the anesthesiologist through right internal jugular vein. We also see a pigtail catheter for pleural fluid drainage. This tip position is no good. It is from right internal jugular vein into the left brachiocephalic vein. Wrong position. PICC, peripherally inserted central catheter, usually through upper arm, usually from right side, by a basilic or cephalic vein. It is a relatively easy method and increase in use of number, usually done by the interventionist of radiology department. No good images of PICC on chest x-ray. Left side image shows the tip of the catheter deep in the right atrium, and the right image shows the tip is in right subclavian vein. Another not so good examples of a PICC catheter position. On your left side, a little shorter. On your right side, a little deeper. Another no good examples. One is to right subclavian vein, contralateral side. The other is kinking in the superior vena cava. Guess what? What happened to these 2 catheters? Left side, agios vein. Right side, to the neck vein. This is a nice example of a chemoport tip position. The first and second images are frontal view rotating SVC-RA junction. The last image is lateral film, the position of SVC-RA junction. Another example of chemoport location on chest X-ray. Where is the tip of the chemoport? Up to the left jugular vein. Isn't this painting interesting? Vincent van Gogh painted this one so early, long before the smoking skull. If people smokes, he will die as skull, not just healthy living body. He must have known that cigarette smoking is not good for people's health. Interesting. Perm catheter on chest X-ray through internal jugular vein of right side for dialysis. For case of dialysis patients, the interventionist usually put it a little deeper than junction position, a little deeper into right atrium for stability. Also, the normal Hickman catheter tip position is like this. And let's move to another catheters and tubes. Tracheal tube tip should be mid-trachea. The two round yellow rings are showing us the mid-trachea, where the tracheal tube tip should be positioned. We see the tip in mid-trachea of intubation tube and the tracheal tube. And we also see the central line and PICC in SVC-RA junction. No good position examples of tracheal tubes. One is on right main bronchus and second one is almost to right bronchus intermedius. The left side chest radiograph shows us the rare extreme example of a malposition of a tracheal tip. Tip is in right bronchus intermedius. That's why we see the right upper lobe collapse and total left lung collapse. On your right side, the two yellow arrows show us why the tracheal tube usually heading to right side at the carina position, then to left side, because at distal trachea, the aortic arch compresses distal trachea from left side. That's why the tracheal heads usually are heading to right bronchus. Tracheostomy tube tip should be midpoint between upper end of the tube and the carina. This chest X-ray shows the good example of the tube tip position. Chest tube tip does not have 100% perfect answer for correct position. It usually depends on the patient condition and disease condition, but usually said that posterior superior position is better than other positions because of the gravity and the patient's comfort. This is a no good example of chest tube position. Where is it? It's below the diaphragm. Nasogastric tube tip and the distal stomach is good for position. 2. No good examples of Levine tube position. Left side 1. Yes, right lower lobe bronchus. Right side 1. Kinking in the distal esophagus, not into the stomach. How about the pigtail catheters in the fluid drainage, pleural fluid drainage? Yes, and the middle of the fluid is good enough for drainage. 2-channel pacemaker Shorter one should be in the right atrium and the longer one into the right ventricle. BP shunt, ventricular cisterno-peritoneal shunt, from the head over neck to the peritoneum. It's okay. Swan-Ganz catheter on X-ray. This is totally on cardiac surgeon's hand, not the radiologist's hand, but it should be usually within 2 cm around the hilum. This handsome, gentle, healthy, strong-looking man is telling us, come to where the flavor is, come to Marlboro Country. But now I'm asking him, where are you now? Where have all the Marlboro men gone? Regrettably, most of them died of lung cancer and COPD due to heavy smoking of Marlboro cigarettes. You quit smoking? Wonderful. You subscribed and said good to me. Awesome. Thank you very much. Have a wonderful day.